Good day. My name is Dr. Mishal Ibrahim. I am a general practitioner from Cape Town, South Africa, and a current postgraduate diploma of diabetes student from the University of South Wales. As part of my diploma, today I will be discussing foot care in diabetics, aimed at individuals with diabetes or for caregivers, family members, or friends of someone with diabetes. Before we dive into the topic, the first thing we need to understand is why foot care in diabetics is so important. According to global statistics, from 2010 to 2020, it has been estimated that the number of amputations attributed to diabetes is around 235 per 100,000 individuals. This equates to roughly one person per 425 individuals. Out of all the amputations not attributed to trauma, diabetes can be attributed to up to 70% of cases. 37% of diabetics undergo a second amputation within 5 years. Now you might be thinking, why are amputations so important to prevent? Is it the distress in coming to terms with being an amputee? Is it the emotional burden? Is it the difficulty with mobility and being able to work afterwards? Yes, these are important, but overarching all these factors is the increased risk of death. Depending on the level of amputation, the risk of mortality in the coming 5 years after amputation can be up to 90%. In the modern age of technology, and with the introduction of social media, we are in the era where access to information is easy. But with this comes the increased risk of fake news. A common myth in the community is that when you're diagnosed with diabetes, amputations are inevitable. Allow me to challenge this myth by demonstrating a hypothetical case. Meet John, our hypothetical patient. Now John is 52 years old. He has been diagnosed with type 2 diabetes around 10 years ago. Now, John hasn't been quite strict with his diet and hasn't been taking his medication religiously. As a result, John is now an unemployed construction worker due to a previous right leg amputation around 1 year ago. Now, John's story is not isolated, nor is it a special circumstance, but in fact a relatively common occurrence. Now, around 2 years ago, John was working on a construction site, as he normally would, until he accidentally stepped on an exposed nail. Now, because John was wearing shoes and did not feel any pain, he simply removed the nail and went about his day. However, little did John know that he in fact began a vicious cycle that would in fact change his life forever. You see, even though John did not feel anything, the nail in fact penetrated his foot and left an open wound. This wound went unnoticed for so long that it became infected. The infection subsequently spread to the bone, urgently requiring an amputation. The fact of the matter is that up to 85% of amputations are indeed preventable. Unfortunately, in John's case, he had neuropathy or nerve damage. This, coupled with vascular disease or disease of the blood vessels, with the subsequent development of an infected wound, in combination is a recipe for disaster. If we dive deeper into the factors leading to the diabetic foot, we focus on two aspects that are the result of poorly controlled diabetes. That is neuropathy or nerve damage and vascular disease or blood vessel problems. Now, nerve damage in diabetes leads to foot deformities, which we'll discuss later, loss of sensation with the inability to perceive sensations like pain, temperature, vibration, and dryness due to the reduction in sweating, which can lead to fissures on the foot. These fissures, like other open wounds, can form a breeding ground for infection. Changes in blood supply occur due to obstruction of blood vessels. This reduced blood flow delays wound recovery as well as impairs the body's response to infection. When considering the approach to foot care, the evidence has shown us that while foot care is important, the knowledge is quickly forgotten. Thus, in order to improve memory recall, I've suggested using the looks mnemonic in order to remember the important principles of foot care. The L stands for look. This involves looking or inspecting your feet daily, often with the help of a mirror to visualize the sole of the foot. What you're looking for are any cuts, calluses, open wounds, ingrown toenails, or skin changes such as fissures. Lastly, make sure to look inside your shoes for objects that may cause injury. The first O stands for observe. This entails observing your feet for deformities. Some important types include hammer toes, claw toes, and high arch. You're going to observe for any changes in sensation such as tingling, burning, or numbness. And lastly, the Ipswich test. The Ipswich touch test is a simple, quick test that doesn't require any specialized equipment. It can easily be taught to others, and it is approved as a light touch sensory test for neuropathy, although it's more effective at detecting advanced disease. To perform the Ipswich touch test, you will require an additional person to assist you with the test. The test is best performed on a flat surface like a bed. The person assisting you with the test will ask you to close your eyes. The volunteer, using the tip of their index finger, will lightly touch the tips of your first, third, and fifth toes on both feet. They should make sure not to poke, tap, or push the toe. You should then respond whether the touch was felt. If the touch is felt, this corresponds to a positive result. If the touch is not felt, this is a negative result. If less than 4 out of the 6 touches were felt, this could be suggestive of a neuropathy. However, you would require a consultation with a healthcare professional in order to confirm this. The second O stands for offload. This refers to the offloading of excess pressure on vulnerable feet. This is done through avoiding walking barefoot, wearing proper fitting footwear, and considering specialized footwear. This also includes avoiding direct pressure over vulnerable areas of the foot. This picture illustrates the deformities associated with diabetes and their resultant changes in pressure distributions over the foot. As you can see, as the foot becomes deformed, the areas where most of the pressure is exerted changes. This forms the basis for the design of specialized footwear for diabetics. 2 important types of diabetic footwear include in-depth shoes, which provide extra space for deformed feet, as well as providing shock-absorbing properties. Orthoses. These are specific types of insoles which are designed in order to relieve pressure of vulnerable areas of the foot, as well as providing shock absorption properties. Along with specialized footwear, there are also types of footwear that diabetics should avoid. These include flip-flops, high heels, and toe grip sandals. The K stands for keep clean, safe, and dry. This involves keeping the feet dry and always wearing socks with shoes. Making sure to avoid excessively hot water, especially in the bath. Make sure to moisturize your feet often, avoiding in between the toes. And finally, the S stands for seek professional help. One should do this with any foot injuries. If there are any deformities or changes in the foot shape, or any changes in sensation that have been noticed. Additionally, avoid self-treating calluses and ingrown toenails and rather seek professional help. To summarize, The take-home message is amputations can be prevented through proper foot care and regular screening. When in doubt, however, consult